This segment of the Medicare Minute is sponsored thanks to a generous donation from Honor Guard Flags, a proud veteran-owned business and proud member of the Grand Prairie Chamber of Commerce. Honor Guard Flags helps you show your American pride all year long. For one affordable annual fee, they'll place a beautiful U.S. flag at your home or business on each of the 4 major patriotic holidays. The team handles everything, setup, takedown, and storage, so all you have to do is enjoy the sight of Old Glory flying proudly in your yard. Support a veteran-owned business that serves with honor. Sign up today at Honor Guard Flags and let your patriotism fly. Want to help us keep Faces of Grand Prairie going? Buy us a coffee. It's a simple way to support local media that celebrates and educates our hometown. Welcome back, Kevin.
How you doing again?
Doing good. How are you?
I'm good.
Good. Well, what Medicare Minute are you going to share with us today?
I think an important thing not a lot of people talk about are mistakes to avoid, maybe helpful hints for people. Because again, this time of year with Medicare, seniors feel so pressured because they're sold on the fact that if you don't do it right now, you're going to miss out. Well, first of all, Medicare initial annual enrollment period, which is October 15th to December 7th, that's 7 weeks, including the first 2 weeks, which we're in now, October 1st to 14th. So you have plenty of time. Whether it's a phone call or someone in person, do not feel pressured to make any decisions unless you're comfortable with it. And if you call me, of course, I can help you through all that. But one of the biggest mistakes, I think, that you want to try to avoid is missing enrollment deadlines and planning ahead. And that's one of the reasons I'm glad you and me are doing these, to let people know in advance.
Mm-hmm.
I have a lot of my seniors that will wait to the very last minute and then run out of time. And then December 8th rolls around. They're right back in the same plan until January 1st. So what I try to do is if you look at my Facebook feeds, Risk Down Insurance, also Grand Prairie Medicare, each day I'm putting a 15-day countdown pamphlet, or flyer that kind of talks about annual enrollment and all these other things. And it's just a constant reminder to let people know you have to do something. I mean, it's better to do it early on. That way, you get it out of the way.
Right.
So planning ahead, whether it's the initial enrollment period, you're just getting ready for Medicare, going on Part A and B, setting up an account on SSA.gov, or the annual enrollment period, which is your yearly review, which you should definitely do. The second thing, and it kind of goes along with it, is just reviewing your yearly coverage.
Mm-hmm.
And like I said earlier, I did an event today at the summit, and I kind of mentioned everybody there. If you're only going to review your insurance once a year, it should be this time of year for your Medicare. And then sometimes it reminds them, well, maybe I should take a look at my life insurance. And a couple of people asked me about home health care, long-term care. But this is the time of year that it triggers people to go ahead and talk about, review all of their insurances. Now, there are rules. You have to talk about like a Medicare Advantage at a different time than a life insurance, but you can talk about health. So there's different rules for that. But that's another thing. Definitely do a review, plan ahead, and don't miss the deadlines.
I have a question about the plans. So basically, a provider can decide every year if they want to be a part of a particular system. So they can do that every single year.
From my understanding, a primary care doctor, they have the choice to switch. Physician network.
Okay.
It's, Texas Health Resource, WellMed, whatever. So, if you're my primary care doctor, you might take several different carriers, and you might change. Let's say you want one carrier, you like that better than another carrier, which is not supposed to be. Let's just say that's a situation, and I'm going to you, but the carrier that you're going to stay with has a different physician network. I can still go to you, but what about all my specialists? So it's important that, and doctors normally they send letters out, make people aware of that, so they have time to review.
Like even hospitals.
But not all the time, But a lot of times doctors will stop taking Medicare, they'll retire, they'll get out of the whole Medicare system. So, and it doesn't, carriers, you would hope all the directories are updated with all that, so you look them up. But sometimes if we're unsure, I'll actually call the primary care doctor for the person just to make sure. And again,
you can do that?
Yeah, I go the extra step for people, and if that's why I tell people you don't have to make a decision right now. So if we're unsure about a medication or a doctor or whatever, I don't make things up. I don't try to act like I know everything. If I don't know something, people respect it. I find out and get back to them, and we just roll from there. So,
One of the
um,
things I think that is like very beneficial is if your friend, okay, let's say that you're in good health, but your friend is not in good health. And let's say that they're going through some stuff that you're maybe not going through. It might trigger some of these events that are like,
yes,
maybe I should check to see if I have coverage for that.
yep.
Because I think that's when people start to think about it is like, oh no, now I need to go to rehab and I
Yep.
don't have that coverage or I don't know where my, so maybe even if you're not in that place, ask friends how have you what are some of
Yep.
the things that you were kind of surprised about, and then that way they can have something to call you for and have you check for them.
Well, that kind of reminds me of a mistake to avoid that I don't even have on my list. But I was at another meeting yesterday on my Wednesday morning Rotary, Arlington Rotary group, and I did a presentation. And one of the people there, he's on Medicare. He's like 80 years old. And he said, sometimes people forget that when you're on Medicare as a couple, it's not like health insurance, it's separate.
Oh, that's a good
Yeah,
point.
husband and wife, they're two separate Medicare plans. So if you have great health, you might want to be on one, and if your spouse doesn't, they might have to be another one. So that's a good point you just brought up. Also, let's say you've never spent one day in a hospital in your whole life, but last year you did as an inpatient. You're in there for, I don't know, 5, 10 days. The plan that you're currently on, maybe it costs more to be inpatient, but you get more extra benefits. Well, now that you know that it's a reality, you might be in the hospital as an inpatient. You might want to focus more. Uh, you want to focus more on inpatient out-of-pocket costs and then the extra benefits, because that's the real money, not just the free stuff. So those are just some little changes that people do need to be aware of.
Yeah, and those little nuances are a big deal.
Oh yeah,
Mm-hmm.
especially if you've never had to have that happen, then you don't think of it much. Like I was talking about in one of the other episodes, I have clients that when I sign them up, they might go with a gap and they don't want to pay for a separate Part D, even though they don't have credible coverage. And I'll warn them, if you don't get it without credible coverage, then you're going to have to pay a penalty.
Mm-hmm.
Well, I've never had to take a prescription medication in my life. Why would I need to get it? So they don't get it. They'll wait 3 or 4 years. Then all of a sudden they start having health issues. They have to get
Mm.
it, which they can, but now all of a sudden they have to pay all that penalty, which is forever. It's not just a one time thing. So those are
Wow.
two little things, mistakes to avoid that you just kind of triggered.
Mm-hmm.
But another big one is, and I got 3 cases going on right now that I have two people. I have one lady that works for a school district and two other people that work for local employers, and they're past 65 and they've never started Part B yet, and that's smart because they have good coverage through work. But the part there, it's credible. You got to have credible health coverage to help you avoid penalties in Part B. So when I talk to these people, we always weigh out how much you're paying, what's your deductible, versus going on traditional Medicare, maybe with a gap, advantage, whatever. And you got to do a fair comparison. But you want to emphasize, you got to make sure it's credible coverage. That's what helps offset you delaying Part B. So with credible coverage, you can delay Part B, which is a big deal. Because
Mm.
remember, Part B triggers the initial enrollment period, which is a one-time thing. Another thing is assuming Medicare is free and covers everything. Well, if you get a
Mm.
Medicare
That's
Advantage,
actually a good I mean, yes.
well, if you get first of all, when you go on Part A and B, it doesn't cost anything, but it's not really free because you already paid for it.
Mm-hmm.
Part B, there's a monthly premium, and then even if you get a Medicare Advantage that has a zero monthly premium, it's not necessarily fee or free because you have fee pay out of pocket fees like pay as you go. Like I might not pay a big monthly premium, but if I stay in a hospital, it's a per day amount. If I get certain tests, if I
Mm.
have a specialist, so it's not necessarily free just because it doesn't cost anything, if that makes sense.
Mm-hmm.
Uh, Cobra is a big one. Cobra is not credible coverage.
Mm.
So if you were to retire, if you stop working somewhere at 65 and all you have is Part A and they say you can get Cobra, it's important that you look at the options because Cobra is not credible coverage. So that means if you keep Cobra for any length of time, you're going to get possibly the Part B and the Part D penalties. So you got to be careful with
Mm.
that. And then let me see. Let's talk about some helpful hints. If you One of the important things in a perfect world, everybody goes on Medicare at 65. Everybody collects Social Security at 65. Some people start collecting Social Security at 62. Some people wait to full retirement. Like for me, it's going to be 67. Some people wait to age 70 to get more money. So that's different for everyone. So a helpful hint is to sign up for Social Security whenever you decide that you not only want to collect it, but if you're getting close to Medicare age and you're already collecting Social Security and you don't have credible coverage, A and B starts automatically. If you turn 65, you're not collecting Social Security and you don't want Medicare right away, and you have credible coverage, so it can get very confusing. One of the first things when you decide on Medicare is when am I going to collect Social Security, because that may or may not affect it. One of the ladies at the meeting today, she's 64. She'll be turning 65 in February, was asking me about that. She's already collected Social Security. She already got her card. So it's an easy fix for her, because now all we have to do is decide what she wants to get in addition to that. So in order to sign up for that, go to ssa.gov. That's Social Security. Another neat thing about that is I just got my latest statement. You can track how much Social Security you're going to get at certain ages, 62, 3, 4, 5, all the way up to 70. So you can plan with that. Another thing, another helpful hint, if you are collecting Social Security and you are going to be on Medicare the first day you turn 65, don't wait till the last minute with that. I mean, I have clients call me sometimes. Matter of fact, another guy at the meeting today, he's going to be 65 in December. So it's already, October. So he has plenty of time, but some people will wait till the middle of November, and then they have 2 weeks. And then by the time they sign up for everything, it might not kick in until January instead of December 1st. So planning ahead, depending on your situation, is very, very important. And then finally, and this isn't the only last one, but I would talk to your doctors every year and kind of find out, because some doctors have plans that they prefer over other plans. Like some doctors only take HMOs. Some doctors, or excuse me, PPO. Some doctors take HMOs and PPO. Some doctors don't take Medicare Advantage at all. They only want traditional Medicare with the gaps. So if you are on a Medicare Advantage, especially, it's important that you tell your doctor every year, I'm going to stay on my plan, or I'm going to change my plan. Are you still going to take this plan? And then you can plan ahead a little bit that way. So that's just some mistakes to avoid, and it's some helpful hints that planning ahead, very important. Don't wait till the very last minute. And then most importantly, talk to somebody, not your friends, not your family, not people who think they know about Medicare. It's that important. Talk to somebody that actually knows. If people reach out to me, hopefully they will, and I don't have an answer, I will find out for them. So that's another segment of some important information that we kind of rushed a little bit, but all these little things we're talking about today are really, really important.
Very important, very important. And as usual, we'll put your information at the bottom so that people can get in touch with you.
All right.
Thanks, Kevin.
Hey, thanks very much.